Hello everyone, today's video is a Q&A video talking today about possible side effects from MSM, talking about using DMSA for ureaplasma, and talking about how one might know that they have been floxed by a fluoroquinolone antibiotic. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the first question is, I've been told that MSM can increase the effect of medication, particularly blood thinners, which could be dangerous. In addition, it may not be safe for people with kidney deficiencies. Any thoughts? So MSM is methylsulfonylmethane. And MSM is a very good source of sulfur. So approximately 30%, 33% of the molecular weight or molecular weight / molecular structure of MSM is sulfur. Because of that sulfur content of the MSM, it helps to improve or increase the ability of the body to make to sulfate things or to create products that have a sulfur group as part of them. And that includes heparin sulfate. So heparin is you might recognize that name potentially if you're into medications and things like that and knowing about them, it is a blood thinning medication, but we create heparin in our bodies and it exists in a form called heparin sulfate. And so indeed, when we take MSM, it is possible that it could increase the levels of heparin sulfate. Now, I am not aware of any cases or any research literature indicating that MSM can create excessive amounts of heparin sulfate in the body. The way I view it and the way it appears to play out in clinical practice is that the MSM brings more sulfur into the body and the body can do with that sulfur what it will. And if it needs more heparin sulfate, it's going to make more heparin sulfate. If it needs more chondroitin sulfate, it's going to make more chondroitin sulfate. If it's needed for sulfation reactions in the liver, it's going to use it for sulfation reactions in the liver, and so on and so forth. I have not seen any excessive blood thinning effects from MSM. There are other supplements that I have seen that certainly have blood thinning effects at high dosages, or sometimes even at not super high dosages in some patients. Higher dose fish oil has sometimes caused obvious signs of blood thinning. Taking certain proteolytic enzymes like stratopeptidase or lumbrokinase or nattokinase, I have seen that cause blood thinning effects in some patients, not often, but sometimes. Never ever seen it with MSM. And as I've talked about in other videos, when I use MSM with my patients, I'm using very high dose MSM. I learned about this from Dr. Kathleen Janelle. She's a naturopathic doctor from the US, and she was on my podcast, the Overcoming Chronic Illness podcast, and she talks about using high dose MSM, typically talking about using dosages sometimes up as high as 30 grams or 30,000 milligrams per day. So, very, very high doses of MSM compared to what most people would use, which is typically 1,000 to 2,000 milligrams a day. And even at those really high dosages, even for prolonged periods of time, like, months, or some patients now have been on high dose MSM for over a year. I myself have been taking high dose MSM for a year and a half now, I guess, give or take. I've seen no excessive blood thinning effects in anyone. I have seen some patients who have reported improvement in their blood flow with the MSM, so suggesting that it does. And those patients seem to help improve their, maybe has an appropriate blood thinning effect, but not making their blood too thin. So a couple of patients who have reported just better circulation, they feel warmer. A couple of patients reporting better erectile function from taking MSM. And so I have seen some blood flow related improvements, but I haven't seen any excessive blood thinning effects. As far as kidney function goes, I have not seen any issues with that either. When they've studied MSM, doing toxicity studies, there are no toxic effects reported from MSM. The only side effect that comes up really is sometimes diarrhea or loose stool, and then sometimes just abdominal gas and bloating, which is ironic because oftentimes it can really help with chronic gas and bloating, but sometimes it does cause gas and bloating, at least temporarily. So I've not seen any kidney issues. Patients who have been on it at high dosages for prolonged periods of time, I have not seen that have any negative impact on kidney function at all. So it seems to be a very, very safe supplement. That being said, if anybody, person posting the question or anybody else, has any evidence to the contrary, anything you've seen from research studies or anything like that, please feel free to post that in the comment section below. Be happy to take a look at that. But so far, have not seen any issues with the high dose MSM. Next question is, can DMSA help with ureaplasma? So ureaplasma is a type of bacterial infection that can cause chronic urinary tract infections, um, and DMSA is a chelating agent, dimercaptosuccinic acid, which is something that can be used as a phase 2 biofilm disruptor. So in my experience, DMSA can absolutely help with ureaplasma in terms of breaking down biofilms if there are biofilms afoot with that particular case of ureaplasma. To my understanding, DMSA doesn't do anything to directly treat or kill the ureaplasma bacteria, but if there are biofilms, then it can certainly help to break those down and help to clear up a chronic infection. I usually combine the DMSA with R plus alpha lipoic acid and bismuth subnitrate, which is combined in a compounding pharmacy into a dithiol complex, and that combined with the DMSA is my go-to for as a phase 2 biofilm disruptor for lots of different conditions, including chronic embedded urinary tract infections, which are oftentimes characterized or oftentimes associated with biofilms. So if there's any further questions on that, I'm happy to answer it further, but or speak to the topic further, but that's the succinct answer to that question. And then the last question today is, says, I know that there is no test to diagnose being floxed, but what are the ways you can diagnose someone? I assume just because someone has had a fluoroquinolone antibiotic doesn't mean they have the toxicity. So it's a great question, and to my understanding, it's really a clinical, when one has been floxed, it is a clinical diagnosis. Floxed is a colloquial term for fluoroquinolone toxicity, or kind of like a post-fluoroquinolone syndrome. For folks that aren't familiar, this is a condition where one goes on a fluoroquinolone antibiotic, which is a certain class of antibiotic, including drugs like ciprofloxacin and levofloxacin, moxifloxacin. And when the patient goes on that medication for their urinary tract infection, pneumonia, their H. pylori, like whatever it is that they're prescribed it for, and then they start to develop some really notable symptoms. Oftentimes those symptoms are associated with a lot of pain and fatigue, and when we really look at it through a kind of look at the symptoms and what they have in common, it seems that the pathophysiology behind getting floxed or having fluoroquinolone toxicity is because fluoroquinolones are very damaging to the mitochondria, unfortunately. So that seems to be what underpins a lot of the chronic symptoms. They're also just directly damaging to connective tissue, unfortunately, so it can lead to, like, it's one of the black box warnings on fluoroquinolone drugs, that they can lead, just in generally healthy people, lead to spontaneous ruptures of tendons and things like that. So it's one of those antibiotics that they're really strong and they're great at what they do, but there are some side effects that are possible with them. You know, for most folks, it's a very rare side effect. Being floxed is a very, very uncommon thing, a very rare thing. But that being said, when you take, 7 billion people, 8 billion people, however many people are on the planet now, multiplied by all the dosages of fluoroquinolones that are administered in the run of a year, it does amount to a significant number of people on the planet. It's not like a 1 in a billion, but it is quite a rare condition. So, but it's something to be very mindful of, being I think judicious with one's use of fluoroquinolone antibiotics. And most doctors, use them as more of like I don't want to say a last resort option, but it's not typically the first line that's recommended. But there are some infections that are just really, really tough to get on top of, and fluoroquinolones are used because of that. So anyways, getting back to the question at hand, how would one be diagnosed? It really is a clinical diagnosis. Individual goes on a fluoroquinolone, develops these symptoms, and that's it. I'm sure that there are clinicians out there that use different lab assays to help kind of support their diagnosis. So there are certain non-specific inflammatory markers. So doctors like Richie Shoemaker and Dr. Dietrich Klinghardt and others, they talk about using different markers like TGF beta levels and levels of complement like C3 and C3A and C4, and MMP levels like MMP9 levels, like matrix metalloprotease levels, measuring these levels in the blood as these non-specific markers of inflammation. So one of the unfortunate things is that one of the most the most popular or common marker of inflammation is CRP, C-reactive protein. Unfortunately, it is not a very sensitive marker for patients who are dealing with atypical chronic pain syndrome. So if someone has a rheumatoid arthritis or polymyositis, or they have polymyalgia rheumatica, these conditions are characterized by high levels of CRP. It's a very useful marker of inflammation in them. You take someone with fibromyalgia, someone with chronic Lyme, someone with mold toxicity, someone with fluoroquinolone toxicity, that CRP level is oftentimes totally normal, and it's part of why a lot of these patients, unfortunately, can sometimes be dismissed by sort of more conventional, medical healthcare professionals. It's like, oh, your blood work looks fine. You say you're in lots of pain and you're feeling really inflamed, but your inflammation marker, your CRP, looks fine. So I guess it must all be in your head, or it's something not related to this. So some of these other markers are used to look for, these are other markers indicating that there can be inflammation. So I'm sure that there are docs out there that utilize those panels. I don't. Unfortunately, in Atlantic, Canada, where I practice, we can't access those types of tests through private labs, and most of the healthcare professionals out here will not run those types of labs that have access to the government funded healthcare system that we have up here. So we don't have easy access to that. But outside of like roundabout, inflammatory marker testing like that, I'm not aware of there being any diagnostic tests for fluoroquinolone toxicity. It is a clinical diagnosis. It is just as a quick side note, wasn't part of the question, but I will just say that fluoroquinolone toxicity is a treatable condition. I've had a number of patients over the years with fluoroquinolone toxicity, and it can respond to it does respond to treatment. It can be a challenging road. Some of those patients are very sensitive to things, but folks can get better. So I don't talk about fluoroquinolone toxicity that often because there's just so many other things to talk about, but any chance I get, I like to just remind folks that might be afflicted by or affected by fluoroquinolone toxicity that it is something that can be treated. It just can be very hard to treat. It can be challenging to find a clinician who knows how to treat it, who knows how to manage the protocols, because these folks can just react to things so easily. It can be very, very difficult to manage, but it is something that can be managed. I will leave it there for now. Please, if you don't mind, take a quick moment to like, share, subscribe, and or post a quick comment on the video. So thanks in advance for taking a second to do that. And if you have any questions or comments on any of these topics or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.